Hello and greetings from Australia to the world. My name is Michelle Gunn, and on behalf of the Global Nursing Policy Leadership Institute Scholars of 2017, I wish the ICN, Nursing Now and nurses worldwide a wonderful International Nurses Day. And I congratulate you all on 2020 being the WHO Year of the Nurse and Midwife. The high regard for nurses worldwide is a great credit to nurses and nursing leaders past and present, and regardless of where you are today or whatever your role is, you should feel immensely proud to be a nurse. While the COVID pandemic has put many of our planned celebrations on hold, the GNPLI scholars wanted to highlight the unity of the global nursing community, share their COVID-19 leadership experiences, and send messages of hope to nurses worldwide. Because it is through our connectiveness and support of one another that we will get through these tough times. Stay safe, wash your hands, use your protective equipment, and wherever possible, stay home.
Morning, everyone. I'm CLEOPATRA BARKOYE, President of the GUYANA Nursing Association. From the first COVID patient on March the 11th, my entire life has changed. I'm at my breakfast table most days in front of this computer, leading, guiding, collaborating, facilitating, even teaching the nurses as to how best we can get through this period in our life. My message to the global community is to be safe in this particular time of COVID-19. Practice things like make sure you always use your hand sanitizers and or wash your hands. It's a challenging time. Guyana nurses has been recognized as heroes, and I know that nursing across the world has been seen as heroes. We are the frontline workers in most cases. Today, I want to really ensure that we be safe because we are nursing the world to health, such an appropriate team. And at this time, our voices will be heard. So let your voice be heard. So be encouraged all the way from Guyana. CLEOPATRA BARKOYE, encouraging the nurses to practice and be safe. Thank you.
Hello and greetings from Canada. My name is Patrick Chu. I am a proud alumni of the 2017 GNPLI program. COVID-19 has brought on significant challenges for the nursing community and for society as a whole. While not directly working in the front lines, I continue to work closely with my colleagues in nursing regulation and in professional associations to support nurses in any way we can. While there are many issues that continue to need to be addressed, whether it's ensuring adequate personal protective equipment or ensuring there's adequate mental health supports for nurses and health workers, I think as a global community, we can be very proud of how nurses have stepped up to the plate. Whether it's engaging in research to advance the science of COVID-19 or working in public health response teams and working on the front lines to support patients, holding their hands during the last seconds of their lives. I think nurses have demonstrated remarkable leadership, compassion, and why investing in nursing is critical. As a global community, I know we will get through this if we continue working together. Nurses are truly a voice to lead and nursing the world to health. Stay safe and be well.
As Chief Nursing Officer in Northern Ireland, my role has been mainly about providing professional leadership to both nurses and midwives, and also supporting the Minister and his executive colleagues to make decisions about our health service during the COVID-19 outbreak. I've provided professional advice to the Minister on important issues during the COVID-19 outbreak. For example, the appropriate use of PPE, how to maintain good infection prevention and control, and how to ensure that our workforce can continue to provide high quality care for people in Northern Ireland. I've had a key role to play in the development of our Nightingale Hospital. That has been a very substantial piece of work involving our whole system coming together and supporting our nursing and medical colleagues in particular to provide that level of care. I have worked very closely with our university and the practice environments to allow our student nurses and midwives to come into practice earlier than we would have anticipated to support the workforce, and our final year students have made that transition, and I'm very grateful for them for coming forward and stepping up to that challenge. These are uncertain times, and I have provided colleagues and the general public with accurate information, which is hugely important. In recent weeks, I've developed a social media series specifically for health and social care staff on topics such as donning and doffing, appropriate PPE usage, and community nursing. It is, I think, important to convey public health messages. To help keep the public informed, I have assisted the Minister at a number of press conferences, ministerial briefings, and undertaken a number of press interviews. There is no doubt that the pandemic has challenged all of us, both professionally and personally, and I can say with certainty that as a profession we have rose to this challenge.
Hello, I am the Dr. MIRLIANA Ramirez. I am a scholar and researcher at the University of Chile, public university in South America. In this moment, we are living very difficult moment. We have fear, sad, but I know if we work together, we can make a great difference. If all the nurses of the world work together, shared her experience, compassion, humanity, knowledge, love, we can make a great difference. It is necessary to include government, politicians, other professionals of health, of course, community and patient. We need to build a different world without frontiers, without borders. We need to share our science, our knowledge, without races, without political ideas, only with solidarity and humanity. We need to make the difference. We need to work together. Love and peace for all of you.
Hello, good morning, good afternoon to all our nurses and midwives worldwide. 2020 was highlighted as the year of the nurse, but this is probably not what we expected. COVID-19 has brought challenges to the whole healthcare sector, and certainly challenges spread across the world. We've all been asked and tasked to do different things to our usual roles, to go the extra mile and to actually work out different ways of ensuring that all our patients, our service users and our communities have the best care available. My work in COVID-19 as head of a nursing department in a university in the United Kingdom has been to make sure that our students' education is not interrupted, to make sure that we will still have the high quality nurses that we need to do the work that's required for future generations. Part of the call in the United Kingdom has been to enable third year students and those near the end of their programme to complete some practice hours in placement, which helps to boost the healthcare system and the number of hands really available on the front line in nursing. But even with that, we still have to ensure that they have the education and all the training and all the requirements for the professional body. The worst thing we could do is to delay the completion of these nurses and in effect affect the workforce we have for the future. That's been a balancing act. Alongside that, as academics, many of us academic nurses, we also have heeded the call to go return to the front line or to help in other areas of healthcare practice and healthcare services. So it's been very complicating. My other work in COVID-19 is my work with the Chief Nursing Officer for England, and that has been leading some of the investigation and some of the support for nurses from Black and minority ethnic communities who have been disproportionately affected by COVID-19, both in terms of illness, death, and dealing day in, day out with the consequences of this virus. COVID-19 has revealed many inequalities in our society and many inequalities across the world. It's a challenge to us as nurses, a challenge to our colleagues in midwifery, and a challenge to the whole healthcare system. Pandemics are not new, but what we do find if we look back over history is the work of good, dedicated healthcare professionals, particularly nurses in this case, has helped not only to spearhead us to recover and move on from this pandemic, but also to make sure that we've learned things for the future. Individual patients, families and communities rely on effective, clear nursing practice and good, effective nursing and healthcare leadership to give them hope and to give them the help when and where they need it. Happy International Year of the Nurse, and remember, our work here is crucial, it's vital, and it saves lives. Thank you.
Pakistan, like other countries in the world, is affected by COVID-19 pandemic. All people have to stay at home, and all universities, schools and institutions were closed for more than 2 months. And still this situation is continuing. But our nurses, alongside with other healthcare team members, they are working for screening, prevention, and caring of patients with COVID-19. I, as academic nurses, my role was not to stop at home. I was and is continuously supporting and preparing my faculty to use e-learning and online teaching approaches. I am encouraging a student to be continue on their teaching and learning process. This is necessary to know that nurses at any health setting, their work, their hard work is not limited by any situation or any problem. Nurses are at the front line of caring of the people. My greeting and my respect to all nurses all over the world. Thank you.
I'm Helen KIRK. I'm the lead for the nursing and midwifery workforce in Public Health England. Today I'm stood outside the temporary hospital for COVID-19 patients in Manchester, the NHS Nightingale North West Hospital. It's been built in a convention centre that was once a railway station. When Florence Nightingale was alive, trains left here for London, passing her childhood home in Derbyshire on the way. It's a fitting tribute on the bicentenary of her birth. My recent work has focused on supporting public health nurses adjusting to new working arrangements and new priorities. I've been focusing on welfare and psychological support services for our dispersed nursing and midwifery workforce, providing professional development opportunities and contributing to national guidance. There's never been a greater need for professional development. We need to make sure that everybody is as prepared as they can be to respond to the pandemic. Our understanding of the consequences of COVID-19 on people, on services and the economy is growing continually. A series of webinars has allowed colleagues to keep up to date with the latest knowledge, guidance and plans. COVID-19 has affected the local populations here differently. It's affected more severely smokers, obese people and those from more deprived communities. Looking ahead, we are already thinking how we can redouble our nursing efforts to tackle inequalities, improve all our health and retain the best of what we're doing in this year of the nurse and midwife. Teamwork, innovation, courage and kindness.
My name is Eva Said. I'm the head of Nursing and Midwifery Development Center from Erbil in the Kurdistan region of Iraq. I would like to thank all the nurses and midwives in Kurdistan who helped the region to cope with the current coronavirus crisis. We can't wait to see you again in our center to continue our training courses. I would also like to thank all the health professionals around the world and wish them all the best, and congratulate all the nurses on the occasion of the International Nurses Day. Your dedication and hard work and resilience is appreciated by all. Thank you very much. Bye.
Hello. Australia was impacted by COVID-19 early with its first case on 25 January. Drawing on the experience of SARS and pandemic planning since, we were quick to mobilise our health workforce, establish border protections and commence testing and tracing. During the early weeks of COVID-19, I travelled to Kuwait to present at a conference. This opened my eyes to the fear that was growing worldwide of this becoming a pandemic, and if it did, the importance of a local, national and international response. Since this time, I have been working on regulatory changes to remove unnecessary barriers to care and ensure that nurses are legally protected as they take on new responsibilities. I've also been responsible for business continuity planning, which has included taking our office into working from home arrangements while continuing to deliver on government priority commitments as the state and nation went into lockdown. Despite being in isolation, we were able to hold a nursing memorial candlelight vigil in April, remembering the sacrifices that have been made by nurses so that we can live the lives that we do. With over 160 sites connecting, it was an intensely human experience. Over the past month, the curve has flattened and the numbers of new cases have slowed to a trickle. Thankfully, our health system has not been overwhelmed as predicted, and most people have now recovered. But we know that this battle is not over, and we'll need to work together and be ongoing in our vigilance so that we're prepared for what lies ahead. Stay safe, wash your hands, use your protective equipment, and where possible, stay home. On behalf of the GNPLI 17 scholars, we want to acknowledge and thank the ICN, Nursing Now, WHO and nurses worldwide for their service and ongoing commitment to global health. Finally, I would like to acknowledge and thank my fellow GNPLI 17 scholars who embody the very best of our profession and who on a daily basis support their communities and each other so that we all may live in a better world.